Hi there. Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. I'm Reed Price, and today Susan Young is with us. We're going to talk about the Alliance for Equitable Healthcare. And before we do that, I want to thank Fieldstone Communities of Bainbridge Island for being a sponsor of Something to Talk About. They offer independent living, assisted living, and memory care. Vibrant memory care community up on Rolling Bay. If you would like to take a tour or learn more, Celia or Jamie would be glad to take your call at 206 594 1010. That's 206 594 1010. Ask them if they can. They will be glad to treat you to lunch or dinner, depending on when you come. And you can also find out about day stay and respite programs at fieldstonecommunities.com. And we are meeting on the ancestral homeland of the Suquamish people, the people of the clear salt water who have lived on the Saley Sea since time immemorial. We are grateful for their stewardship. We need to continue to learn from them about how to care for these lands and waters. And I encourage you to become a member of the Suquamish Museum. Susan, thank you very much for joining us today. I saw an article a little while ago in the Kitsap Sun about the project that you're working on. And I was a little, well, my first understanding of it, just from reading it, looked like you were going to build a hospital because what you're working on is creating a hospital district. So you're here to set us straight a little bit about what the goals and objectives are, right?
Right, exactly. Yes. Building a hospital is not on the list. And I'm happy to start off by just saying that even if we wanted to build a hospital, we couldn't because a law called Certificate of Need allocates the number of hospital beds any county can have. And all of our beds have been allocated to St. Michael. So building a hospital is off the table entirely. But would you like me to go ahead and tell you what's on the table?
Yes, please do. You have put together a slideshow, and so we can go through that, and then we'll take questions at the end. If you have questions in the middle, maybe you're going to say this, Susan. Be glad to put them. Be happy to put them in the chat so we don't forget them.
Right. Yes, please. That's the best way because it's easy to get off on tangents. With this particular topic, everybody has an opinion. So we'll stick to the slides and then we'll go to the questions. So I'm going to go ahead and share my screen and get the slides started. There, can everybody see that okay?
Yep.
Looks good.
Okay, wonderful, great. So my name, as Reed said, is Susan Young. I live in Bremerton. And my background originally was K-12 education. That was what I did as a job my entire adult working life. But I've been acting as a advocate for healthcare for the last 6 years or so now. And so that's what led me initially into getting involved in this kind of work. Today, we're going to be covering 3 different topics. I'm going to tell you a little bit about the Alliance for Equitable Healthcare, what it is. Then we're going to take a look at some of the most critical areas of need in terms of healthcare in Kitsap currently. And then I'll finish up by talking with you a little bit about formation possibly of a public hospital district. I'll explain what it is, what it can do, how it's formed, but you're going to get a 35,000 view overview of this today. I also would be happy, if it's okay with Reed, to send him a PDF of the slides afterward so that he could send them out to you if you would be interested in having a copy of that. So just
Sounds like a good idea. I can also link to it. We'll post this video on YouTube, and in the comment section, I'll put a link to the slides.
okay, perfect. And the one reason I offer this right away is that we do have a QR code and a bit.ly shortened link that will take you to all the different resources that I mentioned today. But I think it's a lot easier if you can actually have an access to the PDF of the slides, and then you don't have to worry about trying to grab a screenshot right now. So we've known for a very long time now that there are some serious concerns when it comes to healthcare availability here in Kitsap County. This recognition led to the formation of the Alliance for Equitable Healthcare, which was founded originally in 2021, and we typically refers to ourselves as AEH. Originally, this was a grassroots organization, but today it's a 501c4, and it's made up of a group of concerned county residents who represent a wide range of background and experience. Since its original inception, our goal has been to find ways to ensure access to affordable, comprehensive, and equitable health care throughout our county. And we're always looking for volunteers. So if you're interested, at the very end, there will be an email address that you can respond to if you would like. 7th of 2023, about 18 months after we originally started to meet, the Kitsap Public Health Board approved a resolution, and that resolution identified 2 public health care crises in our county. The first crisis was high cost and insufficient access to services here in Kitsap. And then the second was, or I'm sorry, I just combined those together. So it was cost of health care, and then it was insufficient access to the health care that is available. This underscored the concerns that we had all along, what brought us together to begin with, and it also led us to the formation of the 501c4 and really trying to step up our game in terms of the work that we were doing. It's really important to take a look very closely at what we already know about healthcare in our community. And we're very fortunate in that there are 3 reports that are linked in the resources that are all relatively recent. And they come from 3 different sources, but basically what they are is community surveys analyzing what some of the biggest issues are here in the county. And you're going to see that there is a lot of agreement in terms of ranking what is the highest priority at this point in time. This first report is the Community Health Needs Assessment that was published by St. Michael Medical Center in 2023. And they identified a list of 5 different areas where there are critical gaps in the healthcare that's available. And those areas are ranked then by the greatest percentage of responses to surveys and conversations that they had with people in terms of how important these different areas were to them. So the area that was mentioned most often under behavioral health, which is up at the top, was alcohol abuse. And then running right behind that were drug-related abuse, especially opioids, and depression and suicidal ideation in our youth. And that was their top area of concern. And then the second greatest area of concern was actual access to health care for everybody. So they're looking at primary care, access to insurance coverage, and Medicaid visits for adults and for the youth in the county. The next report.
Can we just go back and say the other 3 areas that were highlighted: pregnancy and birth, basic needs like food insecurity and poverty, and chronic disease like obesity, breast cancer, and diabetes.
Right. Great. Okay. Thank you. Yeah. So in the next survey that I wanted to highlight for you for a second.
Are you going to go back and give some more, if we have questions, go back when you're finished?
I certainly can. Yes.
Great.
Okay. So the second report that I wanted to highlight very briefly for you is one that was put together by Kitsap Public Health Department. It was released in December of 2023. And then in January of 2024, representatives of 70 different county agencies or agencies related to healthcare that are within Kitsap County, whether or not they were actually a governmental agency, came together and they looked at the results of that report. And in that report, there was something like 17 areas of need. Well, you cannot address effectively 17 areas of need. So they brought these people together to say, okay, of these areas, what are your top 3 concerns? And in this instance, their top concern was access to healthcare, just like you heard in the previous report. And then the second area of greatest need was mental and behavioral health, and also the mention of substance use disorder again. So those were the top 2. The third that they came up with actually relates a lot to issues with the first 2, because it was housing and homelessness. People who are unhoused are more likely to not very successfully be grappling with lack of access to health care, and also mental or behavioral health issues or substance use disorder. So then the third report that I wanted to mention to you again very briefly is one that was published by Johns Hopkins. They were commissioned by the Public Health Board of Kitsap County to come examine healthcare systems, the strengths and the challenges in the county. And they also ended up identifying 5 areas of greatest need in terms of healthcare in our community. And the 2 top areas that were identified again were, this time, top area of need, mental and behavioral health. And again, that includes substance use disorder as well. Access to primary health care came in second. And then the third area was health equity. The fourth was housing, which you also heard with the second report. And then reproductive health, which was mentioned in the St. Michael report. So there is a lot of consistency in what's being identified as areas of need, but mental, behavioral health, substance use disorder, and access to primary care are consistently at the top in all 3 of them. So what's keeping us from being able to address these critical gaps? The Alliance has spent a lot of time talking with healthcare providers, educators, other community leaders, people who live in the county, who are concerned residents. And over and over and over again, as we spoke with people about what was impeding progress, 2 topics came up. The first one was lack of sustainable funding. There's funding out there to take care of pilot projects. You may have heard of the 0.1% grants that are available throughout the county. And that's great seed money to try a new program. But it's not intended, for the most part, to be given to the same organizations over and over and over again, going on ad infinitum. There are a couple of projects that are promised that they'll be funded beyond the first year or 2, but for the most part, that's not what the intent was with these grants. And the second thing that people kept talking about was there's a desperate need for community collaboration. They said they're tired of talking about South Kitsap, Central Kitsap, North Kitsap, as though they're 3 entirely different entities and have no connections to one another. They said very consistently that they want to address these issues as a county, not as a piece of the county. And they believe that that's important because they believe that it would be able to, it would allow us to enhance services that are provided instead of dividing things up and not being as efficient as we could be with the resources that might be available. A group of us from the Alliance actually went to the Public Health Board meeting in March of 2024. And the reason that we went was because that was when the report from Johns Hopkins was actually being publicly revealed for the first time. And during that presentation from the folks at Johns Hopkins, there was a report that really caught our attention. And that report was that, or that statement was that the county commissioners, the Public Health Board, and stakeholders throughout the community needed to launch a formal review to explore the feasibility of forming a public hospital district here in Kitsap County. And the reason that this caught our attention was back in the fall of 2022. That was the year when the emergency room imploded. I'm sure you remember when that happened. The charge nurse one evening ended up calling one of the fire chiefs and asking for help because they were so overwhelmed in the emergency department that they couldn't take care of everybody. Shortly after that, there was a data breach that further interrupted people's abilities to get medical attention. And there were some other things that happened during that period of time. And the result of this sort of confluence of really disruptive events led people, even before the Johns Hopkins report, to start saying, what about a hospital district? Could we do something like that? Could that help us? And if you read the Kitsap Sun, there were several articles at that point in time where people were saying, how about this? Could we do this? So the Alliance had already been looking at what a public hospital district might look like and what it might be able to do. So when we heard this at the report reveal, we were very interested and wanted to get right on it right away. So the report says, develop a sustainable countywide strategy that would allow us to address these gaps and allow us to make sure that people do have access to affordable, comprehensive, equitable healthcare. And so we were looking at models. What might that be? What could that look like for us here in Kitsap? And what we came up with was a public hospital district. A public hospital district is pretty unique to the state of Washington as far as we've been able to tell. There are 62 public hospital districts in our state right now. They're authorized to operate hospitals, but they also are authorized to offer any kind of service that will help people stay more healthy, whether it's physical health, social health, or mental health. And depending on the criteria that's used to define them, there's somewhere between 14 and 18 of the 62 public hospital districts that do not actually own or operate a hospital. So that's what we started looking at as a model, knowing, as I explained earlier, that building a hospital in Kitsap County is completely off the table. So a couple of examples of successful models of this kind of public hospital district right now. One is in North Mason County. It's Mason County Public Hospital District, or PHD 2. And in that particular PHD, they do not own or operate any clinic or hospital. They don't employ any healthcare providers. They don't directly provide any medical services. What they do is they contract with healthcare providers that come in and then offer medical services to residents in the North Mason County area. A second example is Kennewick PHD. It supports its community by contracting with Trios health. This approach then emphasizes for them collaboration and predictable funding for their healthcare services. And they support area healthcare organizations by using this kind of model, and further community wellness by providing education and outreach. So there are several other examples, and if somebody had questions about that, I'd be happy to talk a little bit more about that down the road here. But the important piece to take away from here, in addition to what I've just said, is that PhDs are owned and governed by local citizens. They are required to tailor the services that they provide to the identified needs of that community. And in this community-based mission, there's also a great deal of transparency that ends up being required. So the Alliance continued its exploration of PhDs, but this time we shifted a little bit and started looking at how feasible might it be to actually have a public hospital district in Kitsap County. One of the reasons that we had not looked to it before that was because conventional wisdom was you'll never get a public hospital district approved in Kitsap County. It'll just never happen. It's a special tax district, which I'll talk a little bit more about in just a second. And so don't even bother, bring it up. Try to figure out another way to do this. But based on everything that had happened that I've described to you already, it did seem that this was a good time to actually seriously take a look at this and what we might be able to accomplish. And I do want to emphasize, this is not a panacea. It is not going to fix everything, not by a long shot, but it's a good way to get started. It's a way to start addressing some of our greatest areas of need with funding that is predictable and using a model that will encourage collaboration and cooperation countywide as we try to address this. So how is a public hospital district formed? Well, they are authorized by the Revised Code of Washington, or an RCW. And basically, the way that it is formed is for members of the community to petition for it to be created. In our case, what we're asking for is a county-wide PhD. We're not asking for the county to be carved into separate organizations. And because we're asking for it to be county-wide, we are working with the county commissioners to see if they would be willing to develop a resolution that would put this on a ballot. That does not mean that the county commissioners are raising anybody's taxes. It does not mean that they're for it or against it. What it does mean is that they are giving us, the residents of the county, the opportunity to decide for ourselves. Is this something we want to do? Or is it something we're really not interested in? And that's an important piece in this when you look at how it's governed and where their responsibility, that of the commissioners that are elected to run the public hospital district, their responsibilities lie with the residents of the county. So at the same time that the election happens for a PhD, there's also an election to form a board of commissioners to oversee that district. There can be 3 to 7 commissioners. They're the numbers determined by our county commissioners. Probably it would be 5, but at this point in time, that is something that would still be under discussion. Then I'm sure you're wondering how it's supported, because already I've mentioned that it's a special taxing district. It's like the library district that I'm sure you're all familiar with in Kitsap County already. It's it is a property tax as part of the funding source. That tax can range from 25 cents to 75 cents per $1,000 of assessed value of a piece of real property. Most public hospital districts end up taxing at a 35 cent to 40 cents per $1,000 of assessed value. If we looked at 35 cents and we're doing this county-wide, it would generate just under $23 million a year. That would be predictable income. It would be ongoing every year. As is the case with the library, you don't see library levies coming back on the ballot regularly unless they want a levy lift. So it's the same kind of situation there. And the reason for doing it countywide also is if we say, for example, only ran the public hospital district in North Kitsap, then that would mean the residents of North Kitsap would be solely responsible for that special tax district. It would also mean that people from Central and South Kitsap could still come to North Kitsap and avail themselves of the services available through the public hospital district, but they would not be having to pay into it. So by spreading it out countywide, it reduces the cost that it would be for everybody. If you only did North County and you wanted to still try to raise $23 million a year, you would be being assessed a lot more than 35 cents. Other funding resources are private insurance, Medicare, Medicaid, grants. So the 23 million would not be the only pot of money. There would be other ways to generate income, but that would be a part of it. And also there are tax exemptions for seniors on fixed income, for certain disabled veterans, and then for people with disabilities in general who are receiving Social Security for that. So at this point, again, we're still looking at how feasible is this? What is it we need to be absolutely certain about in terms of strengths, weaknesses, opportunities for this kind of district? And talking, like I'm talking with you all, with folks who live in the community to see where the interest lies. We did do a county-wide survey of voters in Kitsap County back in June, and had very positive responses to the idea of forming a public hospital district, much more positive than even we were hoping for. And so finally, I just want to wrap up by saying that we do think that this is a model that could make a huge difference in terms of getting to the point where we are addressing some of the really serious disparities in the healthcare services that are currently available in our county. And we hope that you'll be interested in learning more, that you might even be interested in joining us in the Alliance to help other folks throughout the county grapple with this idea. And that's pretty much it. So
Great, let's get that email, info@ allianceforequitablehealthcare.org. Info@ allianceforequitablehealthcare, full mouthful there.
Yeah.
Info@ allianceforequitablehealthcare.org. And if folks have questions or comments, if you just sort of wave your hand, I'll call on you, and we can follow up.
And I'll stop sharing unless we need to go back to a slide.
Okay. Proctor, yes, if you just unmute.
There. I want to thank you, Susan, for all this work you've done. You and your colleagues have certainly done a phenomenal amount. I had not seen any organization to have this comprehensive view of the situation. in Kitsap County.
Thank you.
And a couple of questions I have. Was it correct that whatever you do, the Alliance does, needs to be acceptable to St. Michael's since they control the rooms and the capacity, et cetera, available in the county?
Okay, not exactly. We do have a good relationship with St. Michael's. We do have a couple of
I
people.
assume that, yes.
Yes, we do have a couple of people who come to our meetings who do work for St. Michael. What's important in that relationship is that we are not proposing to try to compete with them. What we're proposing is to help alleviate some of the issues they're facing. For example, in the emergency room, the majority of time when they are overwhelmed and there's too many people, and I know you've heard the stories about people waiting for hours after hours to get treated, in large part that's because they have this huge influx pretty much all the time of people who are in mental health crisis, or they're in behavioral health crisis, or they're in substance use disorder crisis. That's not where they should go, but there's no place else in the county that can take them when they are right in that immediate crisis. So if a public hospital district could focus on some of that need and could work with agencies throughout the county, Kitsap Mental Health and Kitsap Community Resources, and other agencies. Peninsula Communities Health is building a facility where folks can go when they're discharged from the hospital, but they're not in any position to go anywhere else at that point in time. Maybe they don't have a home, or they don't have a home where people can help them get better. Then if we could help with the public hospital district, contract with folks to enhance those services, we would be helping St. Michael, because
Yes.
then they wouldn't necessarily be dealing with those kinds of issues. So we would definitely want to work in collaboration and cooperation with them, but we would not be trying to compete, or we wouldn't need their permission to do something.
I guess I'm intrigued by the fact that St. Michael's, as you articulated, has a complete monopoly on certain types of medical care that's delivered to Kitsap County.
Mhm.
In spite of the fact they have an absolute monopoly on that, they require that anyone who goes and works for them sign a non-compete clause, and that seems odd.
Well, they could decide they were going to go off to King County or someplace
Yeah,
else.
but they could go to New York City, King County, whatever.
Right.
But here's an institution. I just have trouble getting my mind around how another institution, such as what you are doing, and clearly it needs access to funding on a regular basis. The group in North Mason County, I thought, was doing a brilliant job, but it's tiny. And as I understand it, really doesn't have ongoing funding that they think is adequate for making it sustainable.
Yes, and that's an argument, again, for going county-wide.
I'm agreeing, totally required. That's
when you carve up a county, you just cannot.
I totally agree. Totally agree.
Oh, I think it sounds like one area that you can't address to kind of amplify Proctor's concern is people who feel as though when it comes to hospital care, there's really only one choice in this county. That is not easily solved, and this would not be the solution to that.
Right.
but it would provide other kinds of health support that are also a problem.
Right.
Correct. Absolutely
Right.
correct.
Yeah, so what the public hospital district would address would be all the other kinds, well, not all, but start picking off
Right.
one at a time, other areas of need that the hospital is not in a position to deal with. They
Right.
have no mental health beds at the hospital.
You don't get paid much for providing mental health.
That's right.
Okay. And do you have someplace I saw, I think it was, maybe it was the number of beds and doctors and whatnot. Do you have it sounded like somebody pulled together a whole lot of statistics on how much care is available, but I may be confusing my different sources. It may have been the Bainbridge Review as opposed to you earlier in the talk.
It might have been, I mean, I know approximately how many beds they've got. It's like 273 at this point, I believe. Okay. Yeah.
Okay, thank you very much.
Sure.
Rita, did you have a comment or question?
You're muted.
Sorry. Yes, I do have one. I was wondering, so it's more like we're coming alongside like St. Michael's, even though we're not, but there's stuff. So there would be care, there maybe could be a community or expanded community behavioral health, that there would be some place that people could go to get some primary care so they don't have to end up in the emergency room because that's the only choice that they have. And even if we started it started as small, it's a step in the right direction. And I kind of, I always hear the stuff about St. Michael's. I've heard both sides, really good care and really not. But you know what? It's what we've got. And so I think starting from there and trying to expand out is the thing to do. And building and keeping a good relationship with that, with what we have, I think is really important. Really important.
Yes, absolutely.
So, David posted a question. Have the studies that you are referencing identified why there are not more behavioral health services within the county, specifically addiction treatment and mental health treatment? Can you address that question?
They haven't so much talked about why as the fact of this is what it is at this point. I think that there's a lot of talk around that. It has to do with workforce need. It has to do with people can go to King or Pierce County and be working in different situations. It has to do, as Proctor said, the reimbursement rate for mental behavioral health treatment is a lot lower than it is for cardiology, maybe. And that's the same issue that we have with OBGYN, is the reimbursement rate for that, or for pediatrics, or a lot of the other areas where we're having issues. It's those are not the money makers. And so that's part of why it's an issue. Also, I think that part of it is that there have been so many disagreements about what's the best way to treat people who are going through mental health crisis. And the money that's been available through grants and that sort of thing often really dictates how that care ends up happening. If you talk to the folks at Kitsap Mental Health, there's a lot they'd like to do, but the funding they've got puts restrictions on them that you might consider to be a bit stringent and difficult to meet. One of them has to do with they can't put somebody in a bed there until they have a physician kind of order that, but the person has to go to the emergency room to get that order. And so then you get into this kind of pillar to post situation where to get the care they need is beyond the capability of a lot of people who are actually in mental health crisis at the time. I don't know if that answered your question or not.
Could I add on to that?
Sure.
So I recommend that the group go back to what KPS Health Plans did in the mid to late 90s when they did develop and install a network-wide accountable behavioral health care system for the 125,000 members of KPS Health Plans. And there's pretty extensive studies. Mel Belding is still in the area, who was the medical director at that time. And I go back to that white paper and take a look at that, because part of what was demonstrated in that, and I was intimately involved, was that the making on the provider side, the accountability pieces be established and agreed to by the providers, and on the payer side to be willing to pay appropriate reimbursement for outcomes-based clinical care. And what happened was that in that population of 125,000 people approximately, in that first year of operation of that service, the rate of utilization doubled, and the absolute cost by KPS dropped by over $1 million. And the primary care physicians were an integral part of the delivery system. It was one of the objectives at the front end that primary care needed to be able to retain communication with their patients. Now, I recognize that KPS Health Plans went away. However, from a model standpoint, and we've continued, when I say we, I'm still involved in behavioral health, but we've continued the development of those systems, particularly in the ER services with Dignity Health, which is a part of Common Spirit, which is the owner of the Franciscans and the St. Michael's Hospital, ultimately, or is the governing organization. And we have some continuing we have continuing operation and studies in terms of how to start to address both the identification of need through proper diagnosis, and then the referral out with that information in order to be able for treatment to be both paid for by the carriers, and then be accountable in terms of outcomes to both the patient, the provider, and the carriers. So this understanding, I mean, I think it's impressive what you've started out to do and what you've accomplished so far, but truly understanding what the needs are and why before you get too far down the road, I would be concerned for you that you do a ready, fire, aim, as opposed to having a more effective approach to the problem and solution.
Right. And that's why I just put my personal email address in the chat. And I'm hoping that you, David, will grab that and send me a note, because I would like very much to talk with you more.
Okay.
So KPS Health Plans, that's is that Kaiser?
No, it was a Blue Shield plan owned by the physicians here in the state of in the Kitsap, Mason, Jefferson County. I believe those were the 3 counties that it covered. It was ultimately, I think, taken over either by one of the Blue Shield plans here in the state, and it was as a result of financial issues that KPS had.
Okay. Thanks for the background for those who are not up to speed.
Yes, and please do reach out to me. I would like to talk with you. We do have a lot of folks who are connected with the Alliance who do have the healthcare background I don't have. Willa Fisher is on our board, and Tom Slider is a retired flight surgeon, and several other folks like that. So we welcome all input and information.
Thinking, I mean, based on the way that you've outlined this timeline, well, obviously David's point about thinking ahead about what this might be, the decision about exactly what services and programs might be developed would be in the hands of those commissioners.
Yes.
Should we go so far as to set up the district?
Yes, absolutely. It is before a solid plan can be formulated, we have to form the district through an election, and we have to elect a board of commissioners. We can, in the election process, say, these are the areas of greatest need. It is highly likely that it would be behavioral and mental health, substance use disorder, primary care, where the Board of Commissioners would decide to allocate resources first. They have to, that elected Board of Commissioners has to come up with a plan. It says in the legal manual, they've got to do a community study. Now, we've got a lot of information already. We are so fortunate. Gib Morrow is an amazing leader in the Kitsap Public Health Department. We have lots of information that he has ensured has been gathered and is available to the public about this kind of stuff. And so the burden that the Board of Commissioners will have is likely going to be less than in a situation where the county doesn't have as much information already available. But it will be the commissioners who make those final determinations. So it's a weird little dance of, yes, we've got to look ahead and we've got to be thinking and we've got to not be getting ourselves down a rabbit hole that's not going to work out, but we can't make the actual plan. And I struggle with that a lot because I tend to be very A to C kind of thing. And I want to plan.
Go to solution. Go to solution.
That's right. That's right.
Okay, Susan, I feel like we've got a great overview here. I really appreciate your giving us that. And then people can follow up, obviously, more information at the email address. And I'd like you to repeat that again since it's shown on the screen.
Oh, I would like to repeat that too. Hang on just a second. It is info@allianceforequitablehealthcare.org.
Okay. Thank you all for your thoughtful questions. And please, Susan, reach out and follow up as this moves forward. Matters a lot to this community for sure, as you know.
Absolutely.
Okay, thank you. Thank you all for participating.